we are here with Ron Clinton today from Knee and Spine PT. This is Ron's Teachable Talks. Today we have a very interesting topic. Ron, you ready for our question?
I'm ready.
All right. So some people may come and see you and maybe have a very painful knee. Something's going on there. And have you ever had where, yes, the pain is in the knee, but the pain is due from a completely different source of the body?
Absolutely. And I think the best way to illustrate that is with a patient I saw maybe a year ago and a patient I'm currently seeing right now. So the first patient was a woman about 50 years old, and she had come in on a walker. She was having significant pain in her leg. And it started at her job where she had to walk from one building to another, and a lot of walking. And all of a sudden, she started having this knee pain. She thought it was probably due to some type of arthritis because she had some knee pain in the other leg at some point, and they told her she had some arthritis, and it kind of cleared up with some medication. But this one was not clearing up. She was very painful. Doctor ordered therapy. She came in. And well, whenever I see a patient with leg symptoms, I always evaluate their spine because I never know if the pain might be referred from the spine. So I had her do some specific directional preference exercises. And after the first set of the exercise, she said, I think my knee feels a little better. I can actually move it a little better. And I had her, walking with the walker in the room. And then we did more of the exercise, so more repetitions. And little by little, by the end of the session, she was able to fold up the walker and carry it out with her because her knee pain had resolved so much that she was feeling minimal pain. Now, it took a few more visits to get everything under control, but she did extremely well long term. The other one was a patient who came in with a similar situation of extreme knee pain. And she was really convinced it was her knee. And I had seen her in the past for a back problem. And so I was a little suspicious, had to clear the back to make sure it wasn't the knee. And I thought, maybe it really is the knee this time. Well, little by little, hers wasn't as dramatic as the first one I described, but little by little, it got to the point where it was completely under control. And we didn't do any knee exercises. It was all back exercises, completely back exercise. And it was a referred pain. And to her amazement, she still was having a hard time thinking, how can it be so much pain and it be the back and not my knee? but this happens.
No, I love that you are really determined to find the root cause, not just treating the symptoms, which some people do the opposite. And I really like your approach. And so the people out there, if you would like to go from walker to walking, see Ron.
Yeah. And if they want to get started on something, if they can't get to me or some of the other therapists that I've trained, they could start with this booklet that I wrote on knee pain, self-managed knee pain, 52 tips before considering injections or surgery. They can start with that. And then another step forward would be looking at the course that I put together that's online on the website, kneeandspinept.com. And you can see all the modules that are listed there. And it's very inexpensive. One PT visit would be about the price of the course, and you get 10 or more visits worth of content in the course. So that's another way to start. Or you can look on the website if you live in Southeast Michigan. There are numerous sites that I've trained therapists in the directional preference method, and they should be able to help you in the same way that I would.
Ron, this is awesome. Thank you for your tip today.
Thank you.